It's about the restoration of our republic. We want to educate, encourage, enable the power. We stand for integrity, honesty, self-reliance, self-defense, and most importantly, no compromise on our foundational principles. This is America's Voice Now.
Find America's Voice Now on Facebook and at americasvoicenow.org. Here's Michael Evans.
Hello, America. You're listening to America's Voice Now. Thank you for joining with us. We appreciate your time and your dedication to the cause of liberty and freedom in America. We're going to cover a number of topics this morning, not the least of which is we have to talk about Obamacare, the upcoming vote that is due on Wednesday and the one that is due on Friday. And we're going to explain the differences between those two votes and the one that really matters. That's Friday's vote. And so today we're going to put out a call to all of our senators and make sure that they are fully aware of where we stand on Obamacare. Now, the only way that we're going to be able to drive the right behavior from these people is to melt their phone lines down. And I'm encouraging you to do that. We'll talk a little bit about that. I'll make sure you have the numbers in order to accomplish that task, and we'll move forward. Our second topic is going to be about global warming, or the lack thereof. The reality is that there is no global warming, at least certainly not in a man-made or man-enhanced format. The planet goes through normal cycles. The sea ice, as you're probably aware if you've been paying attention and following the news, is up by some 65% over the course of the last year. And so what bothers me about this is the fact that science, which is seemingly the one area in which one would expect that they're not really like a partisan group that would fall to corruption, has apparently capitulated into the concept of ideological politicization of virtually everything. And it bothers me that scientists are corrupted in this regard. And so we're going to talk a little bit about that, because what we need to know is that despite all evidence to the contrary, despite the fact that there has been climate gate after climate gate, what we find is that Obama is actually using this phony information and these phony facts to destroy our nation from the inside. If you didn't see the post I did the other day, he's utilizing these climate change claims essentially to restrict coal use in the United States, which, according to his own statement, is going to necessarily skyrocket electrical costs. And if you are not aware of it, I don't know about you, but our costs for electricity have literally gone up about 40% in the last 12 months, maybe even higher. And so I was reading an article the other day in a Springfield paper. Theirs went up 45% last year and 35% again this year. And that, ladies and gentlemen, is the real danger here. The issue is that our electrical services that we receive at our homes and our businesses are going to climb so high that we will be restricted from being able to utilize the things that we use on a day in and day out basis in our homes. And the cost of manufacturing and transportation and all of the goods that are associated with every business will climb directly related to the cost of electricity. Our third segment is about the Federal Reserve and quantitative easing. Now, there's a debt explosion being built, and we're going to look at that. For the record, the debt currently, or the Fed currently holds $3.4 trillion, yes, I use the T word, $1 trillion of national debt. And for the record, I want you to understand exactly what that is. That is the deficit for the last 4 years. So when we say that we are borrowing money to accomplish the unbelievable expenditures that this Congress and this administration have passed, you have to realize that we're not borrowing it from foreign countries. I know that sounds unusual to you, but we're not borrowing it from foreign countries. The reason why is simple. They don't want our debt anymore. And so the Fed is buying it all back. That, ladies and gentlemen, is a scary prospect. Essentially what it comes down to is the Federal Reserve is now the holder of more debt than all presidents combined from George Washington all the way up to the Clintons. That is an amazing statistic. Our last segment is going to touch on two different topics. One, the IRS and Lois Lerner, her recent retirement, and we're going to talk a little bit about the issues surrounding that, not the least of which is she's been on paid leave for the last 3 months, and as a result of that paid leave, she has been paid in full while she was vacationing at home, if you will, and now, as a result of her retirement, before she could be fired, because she got the word that they were going to fire her anyway, she now retires with a full pension of about $50,000 a year. We're on the hook for it. The last thing we're going to talk about is the 1 million truckers rally that is occurring in October. And I want to make sure that you're all, one, online with that, two, that you're informed and fully participating in that, and that we are supporting it. Those of us who aren't truckers, we certainly have an obligation, a duty to support that. It falls right in line with the goals of all the other ideas that I've promoted along the line of stating that what we should be doing is shutting this government down for lack of funding. If we starve the beast, we can accomplish far more than we can by calling our senators and whining in emails and calling in letters and things like that. The simple truth is, governments run on money. And if we shut off the money supply, they starve to death. Immediately. Not months, not years, immediately. If you want to end what's going on in our nation right now, the one thing that you can do, well, I'm only one person, what can I do? I'm going to tell you what you can do. You can participate with us and shut off the flow of commerce. All right, so let's get into our first topic this morning, Obamacare and the not-so-affordable Obamacare. There was an article yesterday that came out, and it's a very interesting one. It's in Forbes, and I'll post a link to it in our YouTube video, and I put it up on our website. Spending for a family of four, a typical family of four, will increase by $7,450 for a family of four. Now, let's understand something. We're talking here about, this is the same spending that we were told by President Obama during his endless promises that we were going to see a $2,500 per family decrease for the same size family. And instead, we've seen a swing not of $7,450, but if you anticipate or take into account the fact that it's a $7,450 increase, that means it's actually a $10,000 swing. In other words, it's $7,500 plus the $2,500 that Obama promised us we'd see as a discount, right? So he was off by $10,000 per family. This is an amazing statistic, and it shows you why Americans are dead set as a collective group against Obamacare. Now, the truth is, the numbers are starting to come in, and the Medicare actuaries have yet again reported that in the first 10 years, Obamacare will boost the health spending of the United States of America by $621 billion. Now, for the record, $621 billion, we've kind of lost the ability to fathom what these numbers actually mean. And the reason I say that is because I can remember when our debt was in the billions of dollars, in the hundreds of billions. Now we're into the multiple trillions, and you kind of lose scope of how big a number that really is. When you talk about $621 billion, you get that deer in the headlights kind of lost feeling, right? And what you have to realize is that we were promised a $2,500 annual savings as far as we could see. In other words, from Obama's lips came the promise that we would see a $2,500 reduction in the annual savings or annual costs for health care for a family of 4. We were also told we'd be able to keep our doctor. We were also told that we would be able to keep our existing health insurance. We were also promised that we would be able to keep our existing hospitals. And the truth is, now that the word is really out, that's not the truth. The real reality of this is simply this. Obamacare is a tragedy for America. And I read an article yesterday in the New York Times that was also quite interesting. And I'll see if I can't dig that up for you. But here's the real problem that we have. What we're going to get out of Obamacare is exactly what the United States of America didn't want. We're going to see reduced the plans that are coming out from the state exchanges, those states that have actually developed an exchange. And by the way, there's only a few that have. The vast majority of states don't have an exchange. So we're not even really yet able to see what those true costs are going to be. We can only go by those states that have actually put one in place. And what we are seeing is very, very frightening indeed. There is an interactive guide on this particular website here from Forbes that will show you, if you choose your state, what the cost increases will be. And what we're seeing are not single digit, but double digit increases in the health premiums that you're going to have to pay. Now, the states that actually have an exchange in place, these are for people who will. These are under the Affordable Care Act. These are the people who will be buying insurance premiums as a result of Obamacare. And I saw an article in the New York Times I referenced earlier that basically was stating that what you're going to see is a significant contraction in what hospitals you can go to and what doctors you can get. And a lot of the people that were commenting, of course, the New York Times is a very, very liberal rag, but a lot of the folks that were commenting were essentially saying, well, it may be inconvenient, but at least it's health care, and for those people that don't have health care, it should be considered a benefit. But what they don't realize, and what a lot of those people were unwilling to acknowledge or even admit, is that it's not just the 30 million people who had no health care. It's the 30 million people who are losing their employer health care. And they're going to be forced into these exchanges where under their old health care plan, they were in an HMO or whatever the case may be, and they were able to go to local hospitals and that kind of thing. What they're stating is these insurance exchanges are doing is they are leaving out hospitals and doctor systems. And by the way, for the record, a lot of hospitals are owned by groups of doctors. And so when you go to that doctor, when they refer you to a hospital, of course, they refer you to the hospital they own. They refer you to the MRI clinic they own. They refer you to the pharmacies they own, right? And while I'm not suggesting that that's a good practice, because they don't necessarily refer you to the best cost option, they refer you to where they can make the most money. But at the same point in time, if you live in a community that is relatively rural, then you may find that the hospitals in your geographic neck of the woods aren't even incorporated into these plans. In other words, you may find that you have to drive 40, 50, 60, 100 miles to find a hospital or a doctor that is incorporated into the AKA Affordable Care Act plan that you're allocated to. So as an example, let's take a couple of states here and take a look at what some of this information states, because the truth is that what we're looking at here are some pretty hefty increases in state rates. There are one or two states where it actually decreases, but for the vast majority of them, the increases are pretty significant. In Washington, as an example, those people age 27, and they break this out by looking at age 27, age 40, and age 64 as averages. Men are going to see a 54% increase. This is only in the first year. At the age of 27. At age 40, they're going to see a 30% increase. At age 64, they're going to see a 37% increase. Now, when you talk about a 37% increase in your healthcare costs, and you are age 64, the presumption, of course, is that you're on a fixed income or a limited income. And that, ladies and gentlemen, is going to break the back of the senior community in the United States of America. In Oregon, you're going to see a 30% increase if you are in the age 64 range. You're going to see a 54% increase at the age 27 area. And at age 40, you're going to see a 24% increase. Now, for the record, it's incredible to assume that these younger people who are going to be forced to participate in Obamacare are actually going to be benefited by this. And the reason why is because, first of all, a lot of them don't have insurance because they don't want insurance. In other words, they're young, they're healthy. I mean, short of catastrophic insurance, they really don't need it. They don't need long-term care insurance. They need, the most basic type of plan or policy. And yet they're going to be forced into buying plans that offer services they don't really need. By the same token, people aged 40 and age 64 are going to be forced into buying plans that allow for things like babies. Well, at age 40, most people are ceasing growing their family. At age 64, they are absolutely over the days of creating new family members. And as an example, in South Dakota, people age 64 are going to see a 74% increase in their health insurance cost. In South Dakota, men in the age of 40 in the age 40 area are going to see a 90% increase in their premiums. And the youth at age 27 are going to see a 147% increase. 147. I mean, we're talking about going from $94 to $232 per month. Now, for the record, let's just evaluate that for a moment. Because when you're talking about young people in their 20s, especially the age 27, we have to make a couple of basic assumptions. One, they are in the earliest part of their earning years, and so they may not have reached peak earnings, but they are certainly beyond the I just got out of college, I've got my first job, or I'm still waiting tables trying to find one age, right? But yet, what we have to realize is that assumption is wrong, and I'm going to tell you why. We do know, and I covered this yesterday, that 77% of all the new jobs that were created in 2012 were all jobs that were either low income or were minimum wage. And out of the women that received jobs during 2013, the vast majority of those jobs, 75 plus, were waiting tables. Now, this means that you've got college graduates who are getting out of school with bachelor's degrees, master's degrees, PhDs, and these people are literally waiting tables to make ends meet while they look for a job. And many of them are in that upper age range of in their mid-20s, mid to late 20s. So here you've got people who, quite frankly, are very healthy for the most part. They have very limited earning power because they're just starting their career moves. And at the same point in time, most of them are unemployed. Or those that are employed are underemployed. And yet they're going to see an increase of 147% in their healthcare rates. The other problem that we're going to see as a result of this is once you cover 30 million Americans who have been underserved for however you want to classify that. In other words, these are people who've had no health insurance for in many cases years, in some cases decades. And they are unemployed or recently underemployed. In some cases, they are permanently on the rolls of the looter. So they are welfare recipients who are generationally welfare bred. Okay? And these are people who have never had health care. They use the emergency room for everything. They basically have a sniffle and they go to the ER. They don't care because they are bankruptcy proof. They have no income. They have no assets. They have really unlimited debt or ability to build unlimited debt because, quite frankly, they don't have any way to ever pay it back. And if they go to the hospital and they have an emergency room visit that costs $2,700, they don't have a job anyway. All they've got is welfare income and maybe some, Section 8 housing income and some food stamps and whatever they can garner by working off the books. These people are judgment proof, and they really don't care whether or not they create a financial crisis in their lives because they live in financial crisis every day. And so what you're going to see is a lot of these folks who have had no basic day in and day out health care are going to flood the system. And what we're going to see is extensive, long-ranging dates for people to get in for basic care. Now, we know this to be the case because when Connecticut passed health care, Massachusetts, when they put that their version of Obamacare into place as a state, they experienced this, but it was on a state level, not on a national level. And so what we can expect is we're going to see this massive influx of brand new patients who have been, for whatever purpose, inaccessible to the healthcare community. And they're all going to flood in looking for services. And we're going to see an overwhelming of the medical system. The truth is that Obamacare is a dangerous place for this country to be. We're going to see massive increases for those who can pay. We're going to see a massive influx of brand new patients who have never really had health care, or at least certainly not in a long time. And we're going to see those people who are on the edge of being in the poverty rolls versus being in the roles of the lower middle to middle class are going to now fall into poverty roll, because when you're talking about a $10,000 increase in a family that makes $60,000, $50,000, $80,000 as a combined income between husband and wife, a $10,000 hit will completely and utterly devastate that family. It will put them into the poorhouse. Your job is to get a hold of the Senate right now. The number is area code 202-224-3121. That's 202-224-3121. Your job is to get a hold of your senators today, both of them, and you let them know that the vote that is occurring on Friday, if they capitulate and allow Harry Reid to determine and control what occurs with Obamacare, you will do everything in your power to remove them from office. If you live in a state with recalls, begin the recall procedures right now. If you live in a state that doesn't offer recall, make them aware of the fact that they will pay at the polls. All right, we're going to take a quick break. When we return, we're going to take on the topic of global warming. I know it's a big topic because it's a big globe, but we've been buffaloed for a long time on this, and the country is making decisions based on falsified information. You're listening to America's Voice Now. We'll be back in just a moment. Stick with us.